myself. I'm also at World Bicycle Relief, and I oversee our strategic information and innovation team. And then we also have Professor Behrens from University of Cape Town, who will be our discussant. So this is our team today. And just so you know, this seminar is being recorded. Just briefly, I think our team presenting today is perhaps a bit unique in this forum because we are both researchers and practitioners. At World Bicycle Relief, we were founded in 2005, and we are an organization that mobilizes communities around the world to thrive with bicycles. So our mission is that communities, students, adults, healthcare workers are able to access education, healthcare, and economic opportunities through bicycles. So what a great advantage we have is with the research that we are undertaking, we can use the findings not only for communications and influencing, but also to innovate. So to implement programs on the ground to address the issues that arise in our research. So I hope that you'll find our presentations today quite interesting. We're happy to take any questions. And just so you know kind of the size of our organization, since our founding, we have either sold or donated over 730,000 bicycles in the field, and we've trained over 3,200 mechanics. So that's just a bit about World Bicycle Relief. And I'll launch into our presentations. I will be starting, will be followed by Winnie and Gail. The focus of my presentation is on a market systems intervention in 5 countries. I'll tell you more about that. Winnie will be looking at some of the key issues faced by vulnerable and marginalized communities around transportation. And then Gail will be speaking to a methodology that we've been piloting in our work. So welcome again, and let me get started by sharing my screen. Okay, I hope that everybody can see my screen. Just nod your head, Winnie, if you can. Okay, great. All right, I will get started just now. So as I mentioned, I'll be sharing a bit about a project we're implementing called Bicycles for Growth, and sharing in particular the market system investigation in 5 African countries. Okay. So just a snippet from one of our focus group participants. They spoke really about the many ways that the bicycle has been a benefit to them in their household. And it would take them the whole day to explain the different benefits that they've realized through the bicycle. So just understanding really the impact that a bicycle can have in the hands of people who don't have access to transportation. So I think most of us know that there are over 1 billion people in the world who are isolated from opportunities, markets, and services due to lack of access to transport. And we understand that bicycles are an affordable, accessible, reliable, and an efficient alternative to walking. And they offer more carrying capacity and easier access to destinations. And an efficient bicycle market system, which I'll talk a little bit more about, serves the transportation needs of the vulnerable. In our case, that's typically rural communities. And for people walking, a well-functioning bicycle market system improves access to natural, social, political, financial, and human capitals. So really all the different aspects of an individual's livelihood. So our study, we collected data in 2022 in Malawi, Rwanda, Ghana, Uganda, and Zambia. It was a mixed method study consisting of secondary data and primary data. Our secondary data consisted of a desktop review of market reports and policy documents. Our primary data consisted of key informant interviews, focus group discussions, and an intercept survey. Our key informant data was collected from our market actors, representing supply, demand, and systems. I'll speak in a bit more detail about those market actors. Our focus group discussions were with women and bicycle-based businesses. And our intercept survey was conducted amongst 1,804 people, 50% of them women, at rural and peri-urban market sites. And we administered the survey in 4 districts in each of the 5 countries mentioned above. This is just an overview of our study sample. Okay. So our research is grounded in the conceptual framework of the bicycle market system. And the bicycle market system is sector specific, but in general, the conceptual framework is a market system. And our market system consists of the individuals and firms engaged in market exchanges of supply and demand, and the supporting functions and rules which facilitate that exchange. So what do I mean by that? So demand is obviously those who use, buy, or own bicycles. Supply are the channels through which people acquire bicycles, so either as owners or as users. The supporting functions that help the supply and demand function are a variety of factors, such as institutions, a policy environment, cultural norms and practices, rules and regulations. So all of those together are supporters of the core market of supply and demand. So just a visual to help you understand. In the middle, we have the core market. So for example, in any of these 5 countries, you have bicycles that are primarily coming into the country, and they're then moving through the supply chain to end users. And then the functions around that market would be, again, like your spare parts, mechanics, and programs, as well as financing. And then the different enabling environment factors, training institutes, donor agencies, national governments, advocacy groups, et cetera, that support that culture of bicycling or that use of cycling. So when we speak about the actors, we're speaking about policymakers, advocacy groups, and then systems such as structures. We're looking at wholesaler of bicycles, retailers of bicycles. We're looking at individuals and institutions who are both purchasing bicycles. And then, as I said, the spare parts, mechanics, and any financial service providers. So I think in any sector, either looking at goods or services, you have a market system that supports it. And this presentation obviously is focusing on the bicycle market system. So market system intervention aims to make a market function more efficiently and sustainably for disadvantaged men and women. It consists of an analysis of the root causes of why markets are failing to meet the needs of disadvantaged people. It examines the actors, the relationships, the functions, and the issues in the market. It promotes a set of principles that guide the analysis and the subsequent interventions. It identifies solutions for improving the lives of disadvantaged by transforming the market system around them. Okay. So just specifically on this project for which we undertook this research, it's funded through USAID, and we're targeting communities who can't easily afford or access transportation. We're looking at, again, these issues of supply, demand, and the supporting systems in the bicycle market system. We are looking at the barriers to a well-functioning market system, addressing the barriers through pilot interventions to increase access and uptake, and then working together with market actors to design the solution. So while the research I'll be sharing was conducted in 5 countries, the pilots will be implemented in 2 countries, Ghana and Malawi. So what I'll be sharing right now are the findings from our market system research. So the key objectives of the research that we undertook in 2022 was to establish the key purpose for bicycle use in each country, identify the status quo and key actors of the bicycle market system, identify the challenges that were faced by market actors, identify the role and contributions of market actors to the functionality of the system, and explore the intersection between the market system and socioeconomic outcomes amongst vulnerable communities. So I'll talk very briefly now through our key findings. If we are looking at the supply side of the bicycle market system, bicycle availability does not appear to be a main reason for not acquiring a bicycle. So in our research, less than 2% of our respondents reported lack of availability. So bicycles are there. And they reported that bicycles are sold by retailers who typically acquire them from wholesalers. These are in main capital cities or large secondary cities. Bicycle services in the form of taxi or good transportation are also available. Most of the bicycles in the market are imported from Japan, China, and India. And there are also individual sellers who are selling pre-owned bicycle. And this seems to be one of the main acquisition channels for most bicycle owners. So buying a bicycle secondhand is much more affordable to people than buying a new bicycle, particularly recently with increases in the supply chain and also the raw materials that go into manufacturing bicycles. So specifically in Rwanda and Ghana, at least 70% of bicycle owners reported acquiring pre-owned bicycles versus new bicycles. Key constraints that emerged are bicycle quality and design. And that's really demonstrated through 60% of respondents in Uganda and 75% in Rwanda had to make modifications to their bicycles. And then in Zambia and Ghana, a third of bicycle owners made modifications. So a modification means you receive a bicycle and then you immediately take it to the shop to strengthen the frame, maybe add a carrier or a basket or include safety equipment. So this seems to be a key issue around the supply and what's available on the market. And people reported that bicycles that better fit their purpose could lead to higher usage. And we heard that specifically in Rwanda amongst some of the other countries. We also understand that most suppliers have a poor feedback channel. So the ability for users to communicate what their needs are is not a well-functioning system. So that's also affecting the supply that's available. On the demand side, walking is the main mode of transportation. And if you see in this table that I've shared, specifically in Rwanda and Uganda, you can see that walking exceeds bicycle use. So in Rwanda, you have 53% of people whose main mode of transportation is walking. In Uganda, it's 52%. And you can see the ownership of bicycles in all countries is ranging from 22% to 40%. So we really have the majority of our respondents who are walking and a small percentage in Malawi and Rwanda who are accessing bicycle taxis and even smaller percentage with the exception of Zambia who are using motorized transport. And that's largely due to the cost of motorized transport. And also, if we look at this from the expense side, the average expenditure in the 30 days preceding the survey in all countries, the average expenditure on transport was lower amongst bicycle users than those using motorized transport. So really only those that can afford it have access to motorized transport. The rest are walking or using bicycles that they own or bicycle services. Cost emerged as the main and common barrier to bicycle ownership. Bicycle ownership rates range between 32 and 54% in all countries. And for example, in Malawi, more than 90% of those without bicycles reported cost as the main reason for lack of ownership. And I think out of all 5 of our countries, Malawi has the greatest socioeconomic challenges in terms of per capita income and looking at average incomes. Our findings show that there's a significant gender and age dynamic around ownership. So bicycle ownership and usage rates are lowest amongst women. In Zambia, the percentage of men with bicycles, for example, is 4 times that of women. Bicycle ownership and usage rates are also low amongst youth, and we're defining youth as 18 to 24-year-olds. Rwanda is the exception to that. So both bicycle ownership usage and rates are higher amongst youth. And in Malawi, we have youth usage also high. But we see that there's definitely an age issue around this, and that's primarily related to income and income that people have to be able to afford to buy a bicycle or even use a bicycle. In all of our countries, there's a high unmet need. For me, one of the interesting findings is that usage exceeds ownership. So there are many people who are using bicycles. There are fewer people that own it. And what we see is that there's a high correlation between frequency of use and ownership. So increasing ownership would likely increase usage of bicycles. One of the key uses of bicycles is for economic purposes, and we saw this across all of our countries. In Ghana, Uganda, and Rwanda, bicycles are also used for children to commute to schools. They're also used for household chores, such as shopping and accessing water. That emerged quite strongly in Uganda, as well as accessing energy. And one of our participants, our focus group participants, shared that our communities are located far away from maize mills and hospitals. In cases where one falls ill unexpectedly during night, we have to carry each other. So we also see high bicycle usage rates for accessing healthcare services. On the rule side, so specifically looking at standards, regulations, and policies, non-motorized transport policy implementation is poor or non-existent in most countries. And it seems the transport policy and infrastructure development favors motorized transportation with less focus on walking and cycling. There's fragmentation of policies across documents. So in Ghana, we see policies around cycling sitting in many different policy guidance papers across different government departments. And then you have those engaged in policy having different perspectives. So for example, in Uganda, walking and cycling tend to be perceived as means of transport for lower income people and therefore kind of maybe less important or not the same investment in policies to support walking and cycling. In Malawi, a country, as we mentioned before, with low resources, road infrastructure and motorized travel is prioritized over walking and cycling. In Ghana, Rwanda, and Uganda, The primary focus of policy around walking and cycling is as a way to reduce transport emissions and reduce congestion in urban areas, which is very important and very critical for environmental and climate change interventions, but often this is to the detriment of people in rural communities where cycling is essential for helping them access services and goods. And then outside of Uganda and Zambia, we did not really see the civil society playing a significant role in the bicycle market system. So through advocacy groups, lobbying groups, they're not as well organized outside of these two countries. On our supporting environment, we see that the cost of spare parts is prohibitive. And as we know, bicycles are only sustainable as long as they're actually functioning. So for example, in Uganda, 40% of bicycle owners reported that their bicycles are not in working order. And we've seen in recent years, particularly after COVID, that the cost of spare parts rose significantly with disruptions in the supply chain and also again with the raw materials. People reported that improved road safety would increase bicycle usage and that poor roads damage their bicycles. So that damage then results in people spending more money on repairs and maintenance. Bicycle users prefer gravel roads to asphalt roads because on asphalt roads, motorized traffic speeds are slower. So often where you have a paved road, cars and trucks are driving much, much faster, which can create a very unsafe environment for cyclists or bicycle users. One exception to our 5 countries is Rwanda, where there's a high quality urban bicycle infrastructure. But then again, this is limited in rural areas. Our respondents reported that bicycle usage would increase with improved bicycle infrastructure, and that's both bicycle paths and secure bicycle parking and storage. And again, this type of infrastructure tends to be limited to either urban centers or secondary cities with, as you move out to rural areas, less infrastructure, which isn't always, I think, as essential, but I think it certainly helps with issues of people feeling safe and secure on bicycles. And then overall, this poor access to finance really impact people's ability to purchase bicycles, for retailers and wholesalers to expand their range of models or spares. So across the bicycle market system, access to finance is a key constraint. So just in conclusion and around next steps, our key findings are that the bicycle market system across sub-Saharan Africa is weak, and that the robust demand for bicycles is not necessarily met by a similarly robust supply side or system side. There's inequitable access of mobility and transport, particularly bicycles amongst women. And then the unaffordability of bicycles as spares and frequent need for maintenance and modification is a characteristic of one of the key demand constraints. Access to finance hinders suppliers and consumers alike in the bicycle market system. And then lack of accountability and resources for policy commitments, cultural norms, and a weak advocacy environment impact the functioning of the core market. So those critical supporting functions. And then just in conclusion, as part of the Bicycles for Growth project funded by USAID, we are now designing pilot interventions to address these barriers that emerged. So these pilots will be specifically in Malawi and Ghana, and they will focus on the affordability of bicycles and spare parts, quality bicycles, quality spare parts. And we will also be looking at issues of safety and advocacy in Malawi, and designing interventions together with market actors in these countries. So that concludes my presentation on the bicycle market system. I will stop sharing at this point, and I will hand over to Winnie, who will be presenting on a project supported by the Volvo Education and Research Foundation. Maybe a quick question, whether we want to take questions now or at the end. I think, Emma, I'll direct that question to you.
I think, shall we leave it till the end? If we go through the presentations first, and then we can have a discussion afterwards.
Okay, thank you. Over to you, Winnie.
Thanks very much, Alisha. I believe that you can all see my screen. Can anyone confirm?
Yes, can see it. Fine, Winnie, yeah.
Thank you. So as Alisha mentioned, I'm going to be talking about a research project that we've been conducting in conjunction with the University of the Western Cape in South Africa, and which is funded by the Volvo Research Education Foundation grant. And basically this research, we are looking at user needs and practices in secondary seating. And in particular, we also are interested in examining the role of bicycles in mitigating mobility exclusion in Malawi and Kenya. So again, our research aim really being to contribute to the evidence base, focusing on understanding user needs and practices among marginalized individuals. And our research focused on 2 emerging secondary cities in Kenya, the first being Kakamega, being Kakamega, which is in Western Kenya, and Zomba being in Southern Malawi. We also wanted to examine the viability of bicycles as a transportation solution for marginalized individuals who are experiencing mobility constraints. So our research questions are outlined on the screen. We were most interested in first establishing who are the most marginalized in respect to access and mobility. What are the mobility needs of marginalized people living in the secondary cities, and are there any differences across groups? We're also interested in understanding how marginalized individuals experience, describe, and define everyday mobility and transport poverty, as well as the implications. And as I mentioned, also at the same time, assess whether bicycles can be a viable transportation tool for them. We've grounded this research within theoretical and conceptual framework around mobility poverty. So we define mobility poverty as circumstances under which inaccessible or unsuitable transport negatively impacts people's quality of life. For example, their access to employment and livelihood enhancing opportunities, healthcare, or participation in their society. So looking at this links to then my next point, which is on social exclusion. So we, once we've identified how mobility poverty manifests itself, we then asked, so how do this then result in social exclusion? So identifying social consequences or outcomes of mobility poverty, and including the inability to participate in key life enhancing opportunities. So thinking here about reduced ability to search for work, poor access to healthcare facilities and markets, food insecurity, and as well as increased physical isolation. We've also worked within a bicycle usage framework where we basically use, we explore the opportunities and potential challenges that bicycle offer as a mobility solution, focusing on examining availability, access, utilization, and sustainability of bicycles in these communities. Our research setting is two emerging secondary cities, as I mentioned, which is Kakamega in Kenya and Zomba in Malawi. Both these secondary cities have strong linkages between urban and peri-urban and rural areas. So we find people tend to travel between urban and rural areas, even though sometimes on a daily basis to access employment or supplies for their businesses. They have different population sizes and demographic characteristics, but I think the most striking differences between the two settings is the higher income poverty levels in Zomba and Malawi in general. So people in Kakamega having relatively higher income levels in comparison to Zomba. In both settings, agriculture is very central to livelihoods, and bicycles are a popular mode of transportation, particularly in Malawi. The usage of bicycles is definitely has warmed in Kenya over time, but in Malawi, bicycles constitute about 80 to 90% of wheeled vehicles on tertiary and district roads. How we approach this research, we used mixed methods of approach. So first, we conducted key informant interviews with government departments and NGOs to better understand who they think are the most marginalized in their communities. So we worked with government officials and NGOs based within the communities that we were interested in. And then also had focus group discussions with various groups, including casual workers or low-income earners, small traders working in sort of the peri-urban urban markets, as well as women-only focus group discussions where we focused on low-income earners or women who are undertaking household care work. And I must mention at this point that all these groupings were based on some of the initial discussions we had with key informant interviews, as well as our review of existing secondary research. We also did detailed quantitative interviews targeting about 170 to 200 people. So basically doing quantitative intercept survey where we randomly approach people in peri-urban settings and market settings. The people who were traveling and available on that day, just and inviting them to participate in a survey to better understand their transportation behavior as well as their decision making around transport. In respect to the focus group discussions, I must mention at this point is that we took a participatory approach towards focus group discussions, where we started each focus group discussions with the participants mapping out their travel within their communities to visually just capture where it is that they're traveling to, how far it is these places are from their homes, and how much time they spend traveling. Yeah. And this sort of maps then lead to conversations around what are some experiences they aim travel within their communities. So in the end, then you'd have a map like this with people showing us how far away, say, for example, a market was, or a church, or kosher mill where they process their maize flour. And these were just some of the most common areas that they were frequenting within their communities. So what were our findings? The first is that in respect to who are most marginalized, in respect to mobility and transportation, what we found based on the literature review as well as our discussions with key informants was that people living in income poverty generally, they constitute a majority of people in the study areas, and they all experience mobility exclusion, poverty, whether they are women, men, the youth or the elderly, or even people living with chronic illnesses or disability. However, what we found in Kakamega is that even within income, within the poor, we find segments that poverty in a way is segmented in the sense that there are varying degrees of marginalization, transport marginalizing the poor. We've also found that women experience mobility, poverty, and marginalization more acutely than men do. Excuse me. So what are the needs of the mobility? What are the mobility needs of the people who were found to be marginalized, and how do these travel across groups? I think I'll begin by talking about why people travel, for what purposes they travel. What we did in this quantitative interviews was to ask people where they had traveled to over a 7-day recall period, the 7 days period preceding the survey. And what we found is that in general, people mainly travel for income generation purposes and less so for leisure or for social activities. So if you see, for example, in Zomba, we've got about 90% of people traveling to their places of employment, whether it's actually a place where they've been employed or to their own businesses that they run in a roadside kiosk or in a main market. Markets are also popular destinations. We see farms also emerging as popular destinations. So in some cases, such as Malawi, we have find that some people own farms outside their household, so they need to travel to those farms for purposes of livelihoods. We find that people travel less for leisure and social activities. So we do find that a lot of people travel to religious organizations, in both cases being mainly to church. But when it comes to people traveling to places of relaxation or even to visit their friends and relatives, you see a lower percentage of people reporting travel for those purposes. We find similar findings in Kakamega, where again, 90% of people reporting traveling to their places of employment. Kids, again, very high number of people visiting religious institutions or traveling to mobile money agents, but we find less people traveling for leisure purposes. So we think that, one of the reasons that they travel for leisure is rare. It's partly due to time poverty. A large share of time is spent by people on income generation activities and including related travel for income generation. And also because leisure is considered a luxury. People are poor and they're trying to source for their livelihoods. In respect to travel destination and frequency and how this differs across different groups, we took the most commonly visited places. These were places that are visited by at least 40% of those we surveyed, and then examined whether there were any differentials across income groups as well as gender. And what we found is that men seem to be more likely to travel for income generation, reporting travel for income generation, and also for travel to main district markets, which are typically located far away from residential areas, as well as to mobile money agents. So again, very much tied to income generation. We find that women are more likely, in the case of Malawi, to travel for household chores. So an example here being accessing water sources. We did find that there are some cases where there are no differences, the share of respondents traveling to either local markets, religious organizations, or to the farms. Again, when it comes to income groups, so I'll quickly mention that we defined income groups here. We divided the respondents into 3 income groups, equal distribution, and then compared whether there were, and then checked whether there were any differences in how they travel or how frequently they travel and the kind of transportation modes they use. And again, what we found is that those who are in the richest income groups are more likely to travel to places of employment, and those in the poorest group more likely to travel to water sources. We also looked into the frequency of travel, so the number of unique trips that people are making to various places, and largely we did not find any significant differences across gender or income groups. I think with the exception of mobile money agent, where we found that men were more likely to travel, recorded higher number of unique trips compared to women. In Kenya, we did not find, in respect to differences across trip destination, we did not find significant differences among men and women in terms of travel for income generation. We did find that there were some differences in whether or not people traveled to local markets, with women traveling more to local markets and to religious organizations. We also found that in respect to the average number of unique trips they took, we did find that there were some differences emerging across gender, with men traveling more frequently to places of employment than women, and similarly also finding the poorest traveling less to places of employment. We found that the people mainly rely on walking in Zomba as the primary mode of travel for most types of travel. And if you look here, for example, in the case of travel to places of work or employment, 70% of the respondents say they rely on walking primarily. We did find that in travel to main districts in the markets, people using motorized transportation more, and this is likely linked to the distances that people need to travel in order to access these markets. We find similar findings in Kenya and Kakamega, that people will rely on walking for short trips, such as to access energy or water sources, but primarily rely on motorized transportation for long-term travel, including to places of work, main market and districts, as well as health facilities. A key finding in the case that in respect to differences between Kenya and Malawi, that in Kakamega we find there's very high usage of motorized transportation, in particular motorcycles, compared to Zomba. So how do people decide what mode of transportation to use? We found that in both locations, cost, convenience, accessibility, distance are some of the key factors that influence decision-making around which mode to use. We find that trip purpose also plays a role in that people will decide to, for example, travel shorter distance, travel to using walking for some purposes, such as just visiting friends, but then choose to take a minibus taxi or a motorcycle when carrying heavy goods or traveling to the market. Weather considerations also emerge as a key factor, as well as the urgency or the trade-off with productive time. So how do people then live and mitigate this mobility poverty that they experience? What we did find from our study is that despite the barriers, people will find ways to travel or mitigate the constraints. So for example, in Kakamega, people will report walking for part of a trip in order to reduce the amount of time they're spending on motorized transport and ultimately the amount of money they need to pay for transportation. We've also found that people are making trade-offs. Our small traders report opting to sell their produce at smaller markets due to the high cost of transportation to larger markets, or organizing delivery. So traders reporting not to travel to main markets to source their supplies, but instead ask the supplier in the main market to put their goods on a public vehicle, and then this is transported to them. And what we found is that our focus group participants in the small traders complained about the disadvantages of this, being that they don't have an opportunity to choose the best supplies, which increases their risk of poor products, or they report that increased risk of product losses, that public vehicles do not deliver their products. Another way that people find ways to travel is that they find ways to finance their travel. So we find that people report borrowing money to travel, and this was significantly emerged as a significant issue in Zomba, and other people also traveling on credits and then paying back after a certain period of time has collapsed. To a smaller extent, we found that people make some form of in-kind payment for transportation, and others do report selling their household assets or livestock in order to travel. However, in respect to traveling on credit or borrowing money to pay for travel, what we found is that people feel that the delayed payments attract interests, so that makes their transportation more expensive. They sometimes struggle to pay off the debt, and this then leads to disagreement or loss of trust between the traveler and the transport provider. There was also a lot of anxiety and harassment reported by people who did this, in the sense that they would get regular reminders from creditors and then feel harassed for it. So what are these consequences of mobility poverty? The first is that when people experience this, they feel they are unable to travel. So in our survey, 76% of people in Zomba and nearly 50% of people in Kakamega reported not traveling at least once in the 30-day period preceding the survey due to transport-related barriers. They also spoke about loss of productive time and their desire to have their own transportation tools, save time and ensure that they were able to travel whenever they wanted to travel. They spoke about reduced access to markets and diminishing returns. For example, their inability to then ferry their harvests from their farms to the markets and really complaining about, in some cases, saying that the cost of transporting the goods is even higher than the proceeds they will receive from the sale of their goods. We also found people reporting that they had limited access to essential services such as health services, agricultural extension services, healthcare, and education. One thing that was also reported was the anxiety and fear around time pressure and emergencies and their ability to fulfill family duties or care. So for example, here a focus group is discussing saying during emergencies such as sickness, funerals, or relatives, we are always under pressure to travel, but then how will we travel? It troubles much the heart because of not knowing what to use to travel to the place whenever they go. Social exclusion also emerged as a key finding that participants describe the fact that they are not able to participate in family, social, religious, and cultural activities, but are constrained by transportation barriers. Time poverty also emerged an issue. In our survey in Zomba, for example, nearly 50% of people said that there were activities they would have wanted to do in the preceding 7 days, but were unable to do so because they were spending time, or they spent a lot of time traveling. And these are some of the examples of the things they reported they would have wished to do. Again, there are some people talking about an inability to business and livelihood activities, but we see a lot of reports of people speaking to social exclusion in the sense that they are not able to attend family meetings, attend social activities, attend funerals, or even, spend time with their own families. So I'll conclude with a quick overview of the role of bicycles in mitigating the mobility poverty that people reported experiencing. The first point I'll make is that there's a high unmet need for bicycles. And this is also following up on what Alisha presented in the earlier presentations on the bicycle market system. And this is particular in the case of Malawi, where we find that only 14% of people report that there was a bicycle in their household. But in respect to usage, we see very high percentage of people using bicycles, either as a main mode of transportation or even as a secondary mode of travel to access other modes of transportation. We see less interest or less usage of bicycles in Kakamega. Bicycle availability is not a key factor in this context. People largely complain that the main reason they don't own bicycles is cost, and not the availability or the bicycle design. There are also gender dynamics at household level that emerge, that women are generally less likely to be the owners or primary users of bicycles, particularly within this, in some of these contexts being very patriarchal. Women also report having to dress differently when riding bicycles, particularly in the case of Malawi, where they're expected to wrap their bodies, and this then has an impact on whether or not they can cycle. We both Kenya and Malawi to grant motorized travel. So people feel that motorized transportation is quicker. Some complain that the hilly terrain makes cycling tedious, and they also complain about the poor infrastructure and road safety concerns. In Kenya, motorcycles are viewed as a better source of income, even for women. However, despite this, people see bicycles that as something they can aspire to, because it is cheaper than owning a bicycle is cheaper than owning a motorized mode of transportation. This is partly one of the key drivers for the high bicycle usage and ownership in some of the contexts that Alisha spoke about earlier. So I think I will stop there for now because I've run over time, and I think we can go through some of the key points after Gail's presentations. I'll stop here now and hand over to you, Gail. Thank you. Sorry, Gail, we can't hear you. Please unmute.
Oh, okay, sorry. Of course, one always has to make that kind of mistake. I will go through my presentation very quickly because I see a lot of questions that I think, well, I'm really keen to discuss a lot of the questions that have come up, and we've also asked Roger to discuss some of the work. So I am just kind of going to go through this in about 5 minutes, otherwise we will run out of time, because most of what I was going to present, what I am going to present, is just building on what Winnie was talking about our participatory data collection method. So we weren't just doing surveys and focus groups, but we were doing active transect walks, and in Malawi, in fact, we were doing transect cycling, where we collected the data. Like, really, this was field work, as in walking in the fields, not field work in the kind of ideological sense. So let me share my screen and go through this quite quickly. Okay, I always forget to do this. So we conducted what we call PGIS, which is Participatory Geographic Information System Mapping, where we started so we did this in Zambia, in Petoke, and in Malawi. We didn't do it in all of our countries. And as I said, just shout if you need, if you want any clarity, because I am going to whiz through this. We worked with the youth mappers in each country, which is a really interesting organization of students at universities. It's partially funded by USAID, the project, or the organization, where they are people who work in geology or geography or social sciences who have a real interest in participatory mapping. So we worked with them as our data collection team. And the purpose of this kind of data collection is really so that we can visualize the data, so that we don't only know that people walk 5 kilometers to the maize mill, but that we can see exactly where these maize mills are and where these 5 kilometers are and what the terrain is like that people are walking or riding over these 5 kilometers, and getting a clearer understanding of why people choose this route when we can see that there's a route kind of just next door where they could have chosen a different route, and really trying to understand in much greater detail these kind of numbers or this data that you normally just read about. So we would ask people to start, as Winnie was showing, we would start with our focus groups, where we would ask people to draw where they travel, and we would use what I always call a spider maps. I know there must be some term for them, where we would try and understand trip frequency, modes of travel, and journey times within our areas of immediate interest. So we would ask people in the focus groups to draw themselves or their area in the middle of the map, and then where they go in a schematic map, what their destinations are, how often they travel there, and how long it takes them. So we didn't ask them about distance in terms of kilometers, but in terms of how long it takes them to get there and how frequently they go. So you'll see the long lines are where they travel far, the thick lines are where they go here quite frequently. And then we ask them to write on those lines how much it costs them to get there, how long it takes them to get there, and why they chose that mode as opposed to a different mode. So if they walk, we would ask, why did they walk? If they rode, we would ask, why did they ride? So we would really try and get this very detailed understanding of how people move. They would also draw the maps of where they live in a non-schematic way. So we would have these collection of really beautiful maps showing where people live and where they travel in a, well, yeah, you can see. So I'm sorry if I am going through this quite quickly. Then what we would do, obviously the purpose of this kind of mapping is then once we have a picture of where people go, we would take a subset of our focus groups and we would walk or cycle with the community participants, with youth mappers and one mentor within each group, and one of the village elders or somebody who would be able to answer questions about our routes. And the youth mappers we collected data using Kobo Collect, which is survey data collection tool, but that captures the data spatially. And then we would walk or ride to these destinations that people have discussed. So if they say they go to the maize mill or the church or the borehole, we would then go there and we would walk with them and we would try and understand what the route characteristics are, what the challenges are, what the barriers are, so that we can not only understand in this particularly nuanced way about people's mobility, but obviously the purpose of this is to try and understand, again, the primary research question, which is that if people are experiencing daily mobility poverty, what can mitigate this poverty? Can bicycles mitigate it? Or are we kind of pursuing some kind of a transport solution that is in fact not a solution to the problem, which won't solve the problem? We would have the community validate the maps, and then off we would go. We would be looking for preferred routes. We would be looking, for bicycle infrastructure, which we didn't really find. We would be going to the markets. We would be going to the key destinations. Bicycle taxi stands were an important destination. We would look at mobility barriers, at the terrain, hazardous locations, and also where the bicycle repair locations are. So this, particularly when we were doing our transect cycling, it was really important to understand how often, if something went wrong with somebody's bicycle, what the difficulties would be in getting access to repairs quickly. So let me go through this. I'm sorry, this is now the kind of thing that is really annoying when somebody whizzes through all their slides, but I wanted to show you the outcome. So what we really found is that doing our mapping like this, it provides very good visual evidence to support and strengthen the findings of a bicycle market system assessment or an understanding of mobility poverty. Because you really can just visualize all of this data in a way that it's very different when you see it on a map and you can see, what the actual lived experiences are. It provides an indication of the impact of road and river crossings and what maintenance or road conditions have on travel time and safety. We found, again, people would describe their trips in terms of journey time. They would usually walk if it was about 30 minutes, also one way, and then they would cycle if it was going to take them longer, if they had a bicycle, if they had access to a bicycle. We found very big differences between the destinations that women and men traveled to. Women would be more likely to go to vegetable gardens, churches, schools, childcare, a kind of fairly typical mobility of care, while men would more likely go to farms, the mosque, places of work, the football grounds. I think they were the only people who mentioned any kind of leisure activity, places of leisure, and construction sites. And we did find when we were doing our mapping that we hadn't included on our capture tool that we should capture where the pubs are, but we very soon found that this was really important. So in fact, one of our slides I'll show you as we captured where all the places of leisure are. So again, this is our findings from Zambia, where we found people walk for 2 to 3 Ks, seldom longer, and then they will use bicycles for more frequent trips. So here we asked people to describe how they travel, how often they travel, what is their mode, and what is their decision making. So why, and mostly we'll find it was they walked because they had no funds, and they cycled because it was a longer distance. We visualized this. I'm just going to show you two of these maps. So this is how we would visualize the data. We would, the nice thing about using this kind of PGS is that you can actually capture the qualitative data. So we've got on the map, you'll be able to see your layers. This actually was using ArcGIS, where the different water points are in this instance, but then we could also have the photographs. So you would be able to click on each of those dots that indicate the water point and see how many people tend to come to this water point, how long it takes them to get there, where they've come from. You would be able to get all that kind of data within each layer. This was, this is the pub where people go to. And we just, this is just very quickly, we used slightly different methods in Zambia and in Malawi. In Malawi, we collected data by bicycle, but in fact, when we collected data in Petuka, which was our second data collection, we walked, because you can collect better data walking. It's for various reasons, but one of them being that it's not easy to cycle and type in on your phone or your data collection device. It's a lot easier to do that by walking, which is sort of fairly evident, really. But in Malawi, it was interesting because so many people do cycle, and so we wanted to try and capture those longer distances. So here's our youth mappers, and that does leave us some time for questions and for Roger to ask us anything that he particularly noted in order to kind of kickstart the discussion. So thank you.
So should I go straight ahead?
Yes, please. Yeah.
Okay, so thank you very much. When Gail asked me to clear my afternoon to sit in this webinar, she said, you must do it, you're going to find it really interesting. And she was right, I did find it really interesting. So thank you to the three speakers for a fascinating set of insights. It's a really nice mix of case countries that you've looked at, a really nice mix of research methods that you've employed, particularly the participatory aspect of it I found fascinating. And it's always very nice to see original primary data collection feeding into our knowledge in this space. So thank you for that. And I would really encourage you to try and disseminate your findings as widely as you can. And I'm not familiar with whatever dissemination strategies you have, so maybe you've already thought about that extensively. I think maybe the simplest way for me to try and kick off the discussion would be perhaps to direct two questions to each of the three speakers. And if you wouldn't mind, let me just go through all of the questions in one go, and then hand over, I guess, first to Alisha to take the discussion forward. For two questions directed at Alisha. So it seemed to me that much of what we were hearing this afternoon was, in a sense, a cross-section of what's going on in the case countries, a temporal cross-section, that is. And I was thinking about the work of a postgraduate Kenyan scholar that we had at our university over a decade ago, looking at the bicycle border in Nakuru and Kisumu. And what he was finding was quite a rapid displacement of bicycle taxis with motorcycle taxis. And it made me think, what did your data collection reveal in terms of trends? I mean, is the use of bicycles on the up or on the down? Did you get any indication from your key informant interviews and from your focus group discussions about how you've presented a nice cross section, but do we have any idea of trends? That's the first question, and the second is kind of a part question, part comment. So your sort of overarching conclusion is that the what did you call it? The sort of the total market system and the supply side of things is not great. And so consequently, they're quite significant costs. But I did find myself wondering, you mentioned that, your main emphasis is on the disadvantaged. And it struck me that, if there were successful policy interventions that began to, reduce the costs of new bicycles, made bicycles more reliable and less prone to breakdown, provided bikes that were better fit for purpose and didn't require the high levels of modification that you speak about, there might be unintended consequences there for some of the most vulnerable folk in those societies, because I can imagine there's quite a large entrepreneurial economy that's built up around the high levels of pre-owned bikes sales that you mentioned, up in the 70%, if I remember correctly, and the very high levels of bike modification. So it strikes me that that policy interventions here would need to be quite careful to avoid unintended consequences. And I think you were kind of heading in that direction around saying, really wanted to focus on the cost of spare parts, for instance. So as not to disrupt that. But your thoughts on that observation, I think I would welcome. Then moving on to Winnie, and Alisha was mentioning it, and so was Gail, this observation that the bicycle ownership and use is lower amongst women, and so consequently that sort of linked to a greater mobility poverty amongst women. And I find myself kind of wondering why that is. The previous studies that I've seen that have spoken to this question have kind of written it off kind of fairly vaguely as being kind of, cultural reasons. In your study, what comes through more is kind of that women are operating within a patriarchy, and that might limit their access to bikes. And so my question is simply, what do you think are the main reasons for that lower utilization and lower participation in cycling amongst women? And if it is a kind of a cultural patriarchy, what are the policy consequences? What can be done about that? Is my first question. And then my second question, sort of linked to the definition of mobility poverty. And what was quite striking for me is that when you compared the trip generation rates across the genders and across the income bands, there were clear differences in the genders that speak to kind of differences in divisions of labor. But the differences across the income bands were much similar. And it kind of led me to thinking about, what are the latent trips? What are the trips that aren't undertaken as a result? And your question about, how many people didn't do things because they couldn't travel, I think, if I remember correctly, 76% in Zomba and 46% in Kakamega. Later slides, you started to give some indication in your word cloud of what those trip purposes would be. So I suppose my question is then, to what extent might those unfulfilled trip-making desires differ across the income bands? I suppose is the question that comes out of that. Sorry for being a little bit woolly. And then Gail, then moving on to you, two questions as well. So very interesting innovations there. I think in participatory data collection, I really enjoyed that. It wasn't 100% clear to me whether that spider map that you were talking about was asking people to recall a period, say, you know, over the last week or the last month, what are all the places that you've visited, and let's begin to map that. Or was it, you know, a more general question about, well, where do you normally go? What are the places that you normally visit? And it struck me that there might be consequences in how that question was framed, because if it's usual normal things, the unusual gets missed. Whereas if it's in a defined time period, there might be unexpected trips that had to be made that recorded. So I guess my first question is, to what extent, how was that question defined, and to what extent did the particular definition perhaps change the nature of the data that you collected? And then my second question, and it kind of dovetails with the comments that I just made to Winnie, using this participatory kind of spider mapping that identified where people were going, how would you use that kind of interaction to begin to capture these latent trips? You know, how would you begin to perhaps extend that to thinking about the mobility poverty and the latent demand and the locations of places that people would have liked to have gone but couldn't? And let me stop there, but thank you very much.
Great questions. I'll kick off with the two that you presented. So one was related to trends related to motorized transport versus non-motorized transport, and how is that kind of changing over time. I would say that this varies by country, depending on income level. I think the overall finding is that motorized transport comes at a cost, and then there's only a segment of the population that can afford the motorized transport. And if we look at the many people walking, it's how do we provide an alternative to people walking? And I think people that can afford other means of transportation or any combination of means, they have those resources. Kenya was not included in our study for the bicycle market systems, but we know that that is a country where there is motorized transport. And I would say Uganda is in a similar situation where there's quite a few sort of motorized transport options, but these are not always available in rural areas. So looking at the specific needs of rural people walking, I think that the trend there is that people are walking, and that there's still interest in bicycles, but there will always be a point to which the bicycle can't meet their needs. And that's where people would seek to use motorized transport in the form of a bus or a taxi or a motorcycle. So I think overall, with the population groups that we're speaking about in the rural areas, that there's still a place for bicycles. The second question around unintended consequences if you bring in higher quality bicycles. One, I would say, if you have higher quality bicycles and spare parts, they will still over time need spare parts and the services of mechanics. So those, I think the costs that people are spending on these things could be invested in other aspects of how they may enhance their bicycles. So rather than repairs, maybe they want to buy a bike, a light or a helmet or something like that. So it's something that I think we could explore in more detail, but I do believe just higher quality bicycles would give those bicycles longevity. So it's that the repairs may not be needed up front, but perhaps over a longer period of time, and keep more bicycles in circulation. As we saw in Uganda, there were 40% of people whose bicycles were out of service. So we would want those bicycles in service. And I think that key issue again is affordability. So the resources to afford a mechanic, to afford the spare parts, to afford the maintenance. So I hope that's responded to the questions that you posed. I do see 2 hands up. I think they're probably related to these 2 questions. So maybe Gail, I'll call on you, and then Emmanuel, I see you also have your hand up.
I wanted to just respond specifically to Roger's question about the shift from motorbike taxis, or from bicycle border borders to motorbike border borders. We didn't specifically ask that question, but it came up in almost every interaction that we had in Malawi, particularly, and in Zambia, and there is very definitely a shift from bicycle taxis to motorbike taxis. In fact, quite a few of the focus groups, people said quite explicitly that they would prefer to buy a motorbike taxi than and operate one than a bicycle taxi. And in Malawi, there was an interesting competition in the sense that motorbike border borders charge the same as bicycle border borders. So they're trying to take the market from the bicycle taxis. So that is an extremely clear trend. And it's a problem because the motorbikes are very poor quality. So there's going to be air quality issues and noise pollution. And it's a problem. But in many instances, if you're paying the same to take a motorbike taxi, then a bicycle taxi, you are going to take a motorbike taxi as a passenger. Yeah, so that was a very, very clear trend. And Emmanuel, whose hand is up here, in fact, was our country manager in Ghana. So it'd be interesting. I'm assuming that you will talk about those same questions in Ghana. Where did Emmanuel go?
Emmanuel, we can't hear you.
You disappeared.
He's there, but he's taken himself off mute, but we can't hear him.
Oh. No, we can't hear you, Emmanuel, even though you are speaking into your phone thing. Shall we carry on with Winnie's questions while we wait for your sound to come back, Emmanuel? Because I'm really interested to hear your response.
Yeah, I think I'll go on and respond to Roger's question. I also wanted to add, in addition to Alisha's response on the issues around better quality bicycles, I think that the market needs to respond to the needs of the consumer. And in our case, in all the countries where we conducted the bicycle market assessment, when we asked people what they would look into in the future when they're acquiring a bicycle, most people who were owners of bicycles at that point talked about getting more higher quality and more durable bicycles. So clearly they appreciate and they see the importance of having a higher quality bicycle, and there's greater demand for that. The only issue being that they can't afford it. So I think in a way the market sort of, if affordability constraints can be sorted out, I think people would be able to go for that higher quality market, and it would mean there would be implications for the complementary industries that support the bicycle market system. Those are just some of my initial thoughts. And then in respect to your questions around gender dynamics around bicycle ownership and usage, yes, that is something that emerged in all our countries, that bicycle ownership is generally skewed towards men. And although in some countries we do find that bicycle usage among women is high, even though they might not own bicycles. So for example, in Malawi, women tend to use bicycle taxis rather than their own bicycles. So I think one contributed to this is obviously the household dynamics around ownership of assets. So typically the assets belong to the male person, and household head, in this case, often the spouse of the women that we were interviewing. And so they would determine then access and usage of the bicycle. In addition to this, bicycle usage is tied also to income generation activities. So to where the greatest need is, and in most cases is income generation. So where people feel in the household that the husband is the one who's traveling far away to markets to sell goods and farm produce, etc., then they would tend to divert the usage of that bicycle towards the men than the women. The one thing I must mention also is that one of the key reasons why women don't own bicycles, when we asked them, was cost. So again, affordability constraints coming up as the main barrier to bicycle ownership. In some cases, we do find that cultural perceptions towards women using and owning bicycles is an issue, again, tied to ownership of assets. But in some cases, such as Uganda, where we found that in some of the districts there, that it is culturally unacceptable for women to use bicycles because, you know, there were perceptions around it being masculine, it would affect their reproductive organs and so forth. But there has been some campaigns here and there to sort of change people's perceptions towards how they view ownership of bicycles, usage of bicycles by women. I think I must mention that, you know, culture is something that takes time to change, even though it is dynamic. And so what we found, I think, in some of our contexts, such as in Kenya, where we give bicycles to, while Bicycle Relief provides 70% of the bicycles to women and girls, we are starting to see changes in how even the community views usage of bicycles by women and girls. I remember in some of the conversations we've had with community members over time, they see girls riding their bicycles to schools, and there's no longer that negative perception towards that, you know, they can't use bicycles. They see it as an important tool for improving access to education. So I think that's one of the ways in which perceptions could potentially change. Having said that, you know, cultural dynamics are a complex issue and obviously needs solutions that are sort of participatory, that have been developed by the community, with the community. And again, just recognizing that these things can take time. But again, going back to that point around affordability, obviously, if we can find a way to solve for the affordability constraint, then we might potentially see more women using the bicycles. They will definitely own, but we might also see them also using them on their roads. And then there was the second question you asked me about the extent to which unfulfilled desires differ across income bands. That's a very interesting question. We'll look at the data again and see how that compares. However, what I will say is that in respect to accessing business and livelihood activities, we did see some indications of people in the lowest income band saying that they wish they would be able to do that if they had not spent as much time traveling. So again, pointing to their lack of transportation, and so their reduced participation in income generating activities because they have to spend more time traveling to do one or two activities. So I think that was one of the key, well, I would say that's one of the findings that we got from the analysis of that data. Thanks very much for your questions. I think I'll hand over to Gail now.
I was going to say, shall we try Emmanuel again? Emmanuel, you're on mute, but you want to unmute and see if your microphone is working. We're not hearing you. Emmanuel, put your question in the chat so that we can at least hear that way. Because so if you put it in the chat, then we can respond. Oh, so I suppose then I need to think about my questions. Roger, we asked people to describe their last week. So we were interested in their week, but we also were aware of the fact that there would be some trips that they would only do monthly. or would be, so we asked them once they had drawn their map, we would then say, but is there something else that you've left out, or is there something else, or so we treated it sort of like a focus group, in the sense that we used it as our kind of thing around which to probe around behavior. And then we would also ask people quite explicitly about where they cannot go. So, the question, because that is something that really interests us, is what people can't do because they can't get there, and the work that we will be publishing sooner or later about the VREF work really goes into that extensively, about what are the consequences of this mobility poverty, all the kind of things that people can't do. And yeah, so we use those maps as a kind of talking point also around where would you like to go but can't. And they were very often things like, people will talk about how they cannot go to funerals, or they haven't seen their family, and the kind of loosening of really important family ties because people just simply can't get somewhere. So yeah, so that's but I just want to see, I just want to still see if I got anything from Emmanuel. So if there are any questions from anyone else, obviously we are still here for about another minute, but yeah. I know Emma wanted to close the discussion with some with what the next webinar will be.
Yeah, I will just share my screen. Which isn't working. Can you see that?
Yes.
Yeah. So as we're finishing now, I just wanted to very quickly draw everybody's attention to the next seminar in the series, which is going to be a panel session chaired by Karen, who's the director of INTALiNC. The session's going to bring together themes and questions which have emerged across the series, and the panel will be made up hopefully by at least one representative of speakers from each seminar. That's on the 5th of July, and the little link to find the link to register is at the bottom of your screen there. So if we finish now, I'd like to say thank you very much to Winnie and to Gail and to Alisha and to Roger for their help today. And hopefully we'll see you in a couple of weeks. Thank you very much.
Thank you.
Thank you. Bye-bye.
Thank
Bye.
you.
Bye.
Thanks, everybody.
Thank you.
Thank you. Bye.
Oh, I just want to capture. I'm just quickly looking at what Emmanuel's answer. Emmanuel, I'm going to share your answer with Roger because he was interested in that. So I've got your answer.